Now for the next nervous system and muscular system issue, which we'll be discussing, is what is known as a progressive bulbar palsy. Progressive bulbar palsy. So you can say it just has to do with the nerve communication between, that's the communication between nerves and muscles. It's not adequate again. So it's just a rare form of motor neuron disease that primarily affect the bulbar muscles. That's muscles controlled by the cranial nerve 9, that's the glossopharyngeal nerve, and the cranial nerve 10, that's the vagus nerve, and the cranial nerve 12, which is the hypoglossal nerve. So that's why you see the tongue is affected, the facial muscles are affected, and the rest of it. Okay. So it leads to progressive difficulties in speech, difficulties in swallowing, difficulties in chewing, and facial movements. So definition is a neurodegenerative disorder caused by progressive weakness and wasting of muscles, okay, innervated by the bulbar cranial nerves. So there's degeneration of the motor neurons in the brainstem and corticospinal tracts. Okay. So symptoms: you have difficulties in speaking, difficulties in swallowing, difficulties in moving your tongue. Then facial muscles, you can't really do all those facial expressions and all. Okay. Then emotional lability. So diagnosis: clinical examination, looking at all those symptoms, patient is suffering from all those various things. They do electromyography to see how the muscles are conducting electricity and all, Then rule out other things. So management: there's no cure, but you do all the speech therapy, nutritional support, respiratory support. Okay, the rest of it.